In 2012, people will be talking about healthcare and the repeal and replace method, as it has become evidently clear that the Republican Party is now looking to take away the American achievement in healthcare reform. Now, the real label of this legislation is called Patient Protection Affordable Care, yet Republicans are dead set against what is now called Public Law 111-148, passed on March 23, 2010, will make up crazy stuff about this law they now call Obamacare. On March 23, 2010, President Barack Obama signed into law the Patients Protection Affordable Care Act, and with a number of signatures from the citizens, 1.4 million, on July 7, 2010, this law went into effect. The Patient Affordable Care Act allows you, the consumer, to have more control over your healthcare premiums. But with the demagoguery on the size of the legislation and what is in the bill has taken the debate out of context. Here's what's actually in the law that is now Public Law 111-148. Section 2704 prohibitations of pre-existing conditions or other discriminations based on health status. Section 2701 fair health insurance premiums, and Section 2702 guaranteed availability of coverage. What does Section 2704 of PL 111-148 mean to you, the consumer? Well, it means that an insurance provider can't disqualify you for coverage based on pre-existing conditions. Now, people have taken that out of context to what is a pre-existing condition. It's a condition that normally would turn healthcare companies away. Something more of the modern things that a lot of healthcare providers are now doing are turning away the sick because they are too poor to fix preventable sicknesses, such as a pain in the tooth. Based on this type of condition, doesn't cost much to cover, but it's too much for out-of-pocket expenses. Under the law provided, that's a pre-existing condition, and healthcare providers are not allowed to discriminate based on the ability to afford payment. This is Section 3008, payment adjustment for conditions acquired in hospitals. The law says, in general, Sections 1886 of the Social Security Act 42 USC-13WW, as amended by the Section 3001, is amended by adding at the end of the following new subsections, an adjustment to hospital payments for health care acquired conditions. That means you, the consumer, must get the care you asked for within a reasonable price if you can't afford the cost. No insurance provider or health care provider can turn you away based on conditions set forth, like the ability to pay. Doing something like this is generally not as easy as many people would think. It's very, very difficult to have a script to read. You'd like to say, you have to put and collaborate. I'm going to show you something, the one-page script on how to make a 4-minute film documentary. And I hope you guys enjoyed it and liked it.